So West Australia is handling a possible COVID-19 cluster the way only West Australia does, by shutting its borders and locking down its people for 5 days. In 2 hours' time, Perth and the regions I mentioned will be in official lockdown. Masks will be mandatory, exercise limited to 1 hour per day, and people are basically advised to stay at home, including school children. This is because a security guard at one of the hotels contracted COVID-19, and in the period of possible infection, that is January 26, 27 and 28, he also visited 16 locations. Now, his housemates have all tested negative for now, and it may turn out that the man has the contagious UK strain after being in charge of a floor of travellers who'd brought in that same strain from the United Kingdom. Now, the Premier and his health department are not without blame on this outbreak. At the 8th of January National Cabinet meeting, it was decided that states and territories should be testing hotel quarantine staff daily, not weekly, as soon as possible. Well, WA didn't begin that process until late last week, 20 days after the Cabinet resolution. Have a close listen to the way the Premier tried to fob this off.
Look, we put in place the saliva testing as quickly as we could, using the health department and the appropriate protocols. Unfortunately, it didn't start till late this week. Anyway, he did the PCR testing as well. It came back negative.
Hang on, they put the testing protocol in place as quickly as they could. That's 20 days after the decision was made. They're kidding. And then when he almost said, well, we could have done it earlier, but he didn't say those words, he then pulled himself up and tailed off. Couldn't answer the question. Let's speak with Sky News contributor Gemma Tonini, who's one of those about to be locked down. Gemma, it's the McGowan way, isn't it?
Well, it's using a hammer to kill a ladybird, isn't it? I mean, this is extraordinary. We saw that. I watched the Premier live on Sky with his media conference, and you're quite right, Chris. This isn't a case of, listen, we did everything right, we did everything we were supposed to do, and it simply got away from us. The fact is that they haven't been testing daily. And even if the National Cabinet resolution wasn't until the 8th of January, after everything that went on in Victoria, why would you simply wait? It's not like the West Australian government has at any time subscribed to anything that the National Cabinet has agreed upon unless it suits them, borders being an example of that. And this is just such another example, Chris, of, a hard border is a tool. It's not the only tool. And this government has spent the better part of 10 months gloating about the lack of community transmission in WA, criticising the likes of Gladys Berejiklian for her outstanding risk management that doesn't involve locking people up 23 hours a day. I might just point out for those of you who don't know the regions that are in question here. So there's the Perth metropolitan area, of course. The Peel region is an hour south of Perth. The southwest is areas that you'd be familiar with, like Dunsborough and Margaret River. They're 3.5 to 4.5 hours away, depending on which part of the southwest you go to.
That's joke. That's
no.
total
That's what
joke.
You need to understand. And in total, it's 80% of the state's population for one case that may or may not have a virulent strain. And we know that the gentleman in question, his housemates have already tested negative. And we also know that this young person in question was working as an Uber driver while working in a hotel quarantine security guard role. That is against protocol. That is against policy, as we know. The state government today just kind of went, well, we don't know how that happened, but he reckons he didn't take an Uber, he didn't take a job during the time he was infectious. Yeah. How do we know? How do we know?
They have mishandled the hotel quarantine. They have mishandled it. Hopefully not to the degree that Victoria did. But the point of this is, and we should explain this, as panic buying goes on, because he scared the bejesus out of everyone in WA. So we've seen this panic buying this afternoon. But if they'd been able to test on a daily basis, instead of waiting 20 days to get that protocol in place, he would have been tested on the first day he may have contracted the virus, which means the number of venues they would be looking at now would be 2 or 3, not 16.
And to that point about, it took us a while to get, why did it take 20 days? Why did it take 20 days? Is it because that they've been so complacent? Is it because that they've been too busy gloating? Is it they've been too busy on the election campaign? I might point out that we go to an election here in WA in 40 days' time or something like that. But you're quite right. I don't accept that it took 20 days to put in daily testing. I work in the private sector. I don't accept that it takes 20 days for those things to be implemented. Particularly, we keep getting told that this is a pandemic, which we know it is. We keep getting told that this is extraordinary timing and extraordinary measures are required. But sure, let's wait 20 days because, you know, it's not apparently that important. The other thing is, you know, Chris, I live in an area not far from the city centre. My area is all about small bars, retail, you know, businesses that are essentially going to have to kiss goodbye to a week's worth of revenue, staff that can't work, not because, you know, if you talk to doctors, which I've talked to a bunch of doctors this afternoon, a couple of doctors at least, who are talking about the lunacy of this approach, because it's not based in risk management, it's based in panic.
Yes.
And we saw what happened at the end of last year when there was the Northern Beaches cluster and the state government threw the roller door shut and made, you know, something like 10,000 people go get tests, and our system didn't cope. Our system lasted like 73 hours or 73 minutes or something like that. I think it's easy. The government deserves criticism, like I said before. They deserve criticism because it's on them, and they have gloated for 10 months. And everybody from the Australian Medical Association to the Australian Nursing Federation to the state opposition here has been saying the same thing for the last 10 months. Are we ready? What have you done to ensure we're ready? If we're not ready, why aren't we ready? And here we are, you know, 80% of the population of Western Australia locked in their homes for 23 hours of a day over one case.
Yes.
The closest contacts of which have tested negative.
Yeah. We've sorted that out. What we haven't sorted out is the fact that everyone went out this afternoon to get toilet paper. I still don't know why that is. I've got no idea, Gemma. All the very best for your lockdown. Keep sane.
Thank you, mate. Thanks so very much. I'll be fine, I'm sure.
Dear, oh dear. There you go.